founder's toolbox and how founders can use that to impact the world. So we'll have Nancy kick it off here, and then have some Q&A probably at the end. I'll hand it over to you, Nancy.
All right. Well, I've already commandeered your sharing, so I think I'm good to go. Are we good with the screens, Q? The slides are good?
Yeah, I think it's good. I can see it. Yep.
All right. Excellent. So thanks for having me. I'm really excited to explore and kind of deepen partnerships between the startup community, ITEN, and public health proper. And I've been chatting with these folks for a while now, and it has occurred to me that it's probably a bit easier to teach the business folks a bit about public health than it is to teach the public health folks a bit about business. I mean, it's a matter of degrees, but I really enjoy this idea of cross-pollinating and weaving together the tools of public health and behavioral science specifically, because that's sort of where I sit, and the startup community, and give founders a peek into sort of the science of behavior change. I talk about this stuff mostly from a kind of child welfare lens. My work has been a lot in parenting and child abuse and neglect and developing innovations around those types of things. But I will reach out to your worlds occasionally, and really I would love a very vibrant chat. So if you want to throw any comments in there, it's not at all distracting, and we can take a moment here and there to talk through the chat to make things a bit more accessible to everyone and applicable. So I'm having a bit of an identity crisis, to be honest with you. I'm a professor at SLU in the Department of Behavioral Science. I also just started an LLC, which I've aptly named Weaverly. Props to my kid for the logo. I haven't really used it yet. This is like primetime logo right here. I don't know. And a few years ago, I developed with my team a public health program called Support Over Silence for Kids. And that was like a culmination of a lot of other things happening, which involved so many missteps and mistakes that I thought I would share those with you. And you could either laugh at me or commiserate with me, or maybe learn something from my misfortune. So I'll just kind of start off with that as a backdrop. So I would hazard to guess that all of us as founders, as innovators, there's somebody's behavior that we want to change. And we could spend some time talking about that in breakout rooms, but for the in the interest of time, maybe give that some thought. Maybe type into the chat, whose behavior do you want to change? Do you want to get a CEO to buy your product? Do you want to convince a patient to engage in preventative behaviors? Do you want to think about sort of investors or people hearing your pitch? Like, in this world of founders, we really want people to do something. We want to inspire a behavior. And oddly enough, sometimes we think inspiring, motivating, prompting that behavior just requires us like yelling really loud, or trying to get someone's attention, or giving somebody a lot of information with a lot of pamphlets. But there's a smarter way to do things. And so what I'd like to talk with you about today is kind of the tools of behavioral science. And I'm going to focus on two chunks: theory and communication, which is like marketing kind of. And then, as I said, sort of talk with you a bit about where I've taken roads that haven't been as productive. Okay, so quick overview on theory first. Behavioral scientists and public health folks, we say this all the time. This is our line. Behavior takes place in a context. And all the world of public health is about studying that context. So, individuals, that little bubble at the bottom, individuals relate to each other interpersonally. They're parts of organizations, communities, and public systems, societal systems. And there are levers at each of these levels that we can move, that we can adjust, that we can address, that will affect someone's health or affect their decisions, their attitudes, their beliefs. And so what's really cool, I think, about this field, and you've probably noticed this too, is that we can think kind of comprehensively, systematically, in this we call it ecologically, about behaviors and how we affect them. So let's take just a quick example from the behavioral science literature. This is called the health belief model. And why this is interesting, I think, is the health belief model was developed like in the 1950s. And it was developed because people were scratching their heads and they're like, okay, wait, we have a vaccine for tuberculosis. And I don't know why people aren't getting the vaccine. Why? Do we just need to tell them louder? Do we need to yell? What do we need to do to get people to get vaccinated? And so this model, importantly, is not just hypothetical. Folks got together and they started brainstorming, why would somebody get vaccinated or not? So they came up with a list of ideas. They put them together in these causal maps. And then from that, they started empirically evaluating whether or not they were right. So is it the case, as this model would suggest, that if your perception of susceptibility to the disease is high, like, oh no, I'm definitely going to get TB, and your perception of its severity is also high, oh my gosh, if I get it, it would be so bad. Together, those empirically increase someone's perception of the threat. I'm very much a threat. TB is very much a threat to me. And if I perceive those two things, then I'm going to take action. There's my dog. My dog, who my kid did not walk today. See, I need to persuade my child to walk his own dog. So these models are not just sort of hypothetical musings. They are empirically supported constructions of how people think about decision making. And so if we were to take this model, for instance, and expand it kind of to be in a more applicable way, we would learn that people are more likely to engage in a behavior, whatever behavior that is, if they believe, if they have a perception that they're susceptible, that the condition may be serious, that they're confident in using the innovation you're giving them, that taking the action that you recommend is actually going to reduce the severity of the condition, that there are benefits to that, and that the barriers they have are really not strong enough to outweigh the barriers don't outweigh those benefits. And so this is important. I'm going into a bit of a detail about this because oftentimes, here's what we say instead. Well, if my customer base just knew how phenomenal my innovation was, they would just sign up and the line would be around the corner. And that may or may not be true. But the more we can really engage in a very deep, authentic, rigorous investigation of customer discovery, then we can find out more about that. Oh, so you don't think you're going to get COVID. You think you're not susceptible because your vitamin D levels are high. Oh, you think you're really susceptible because you see your grandmother a lot, or that the threat would be high. If we take the time to really understand the constellation of attitudes and beliefs and behaviors that our potential buyers hold, then we can shape our efforts to gain that share of the market around that understanding. And that's pretty powerful, because what that means is not only, hey, do these things, but importantly, what it means is don't do all those other things. You don't need to scream loudly. You don't need to, put a bunch of, irrelevant data in a pamphlet. But once you understand your customers, you can really focus on what it is they need to hear from you. And that's a pretty powerful competitive advantage. Then you ask yourself the question, okay, so what do I do? I've heard a lot of folks in this community talk about designing apps. I'm gonna design an app and it's gonna help people sleep, or it's gonna track their health behaviors, or it's going to, alert somebody when there's a need for some sort of social support or social intervention. So there's a lot of technology going on and technology development. And that's super important, how that interfaces with health. And each of those things are going to be way more effective if we can ground that work in a theory base that really reflects a deep understanding of the population. So I'm going to stop sharing my screen in just a minute and open this up for a little bit of musing. So if you're musing and percolating, again, use the chat. So keep in mind, as you're innovating, as this ideation is happening, as this iterative process of discovery and this kind of nonlinear, clumsy process of shaping these really potent innovations happens, that we have some tools we can use to be a bit more efficient and a bit more focused in how we frame what it is we're doing, with a particular eye toward understanding, like, whose behavior do we want to change? Is it the end user? Is it the CEO? Is it a politician? Is it the dean of the med school? Like, who do we need to talk to? And that's really going to shape a lot of what we do. All right, I'm going to stop sharing real quick here. See that we're all here. Any chit chat? Oh, come on, there's no chit chat.
How do you, I was about to type something, but I'll just ask.
You're going to type something? All right, just ask. You're good.
I'd love to hear kind of your thoughts on more of like, how you derive that data from those customers, from those users, from the people you're trying to impact, right? And maybe, how do you do that in the health space, right? Because that's what you're familiar with. And is there a better way? Is there a better way for founders and entrepreneurs to do so in the innovation space? Right now, there's a lot out there about like how to ask good questions and the 5 whys and, that sort of stuff.
Yeah.
But I'd love to hear, kind of what it is from the health science side, and can that be applied?
So the short answer is that it works best if it's multi-method, multi-modality, and very, very formative in nature. And by that, I mean, so if you want to know about somebody's physical activity throughout the day, because you're designing a tracking app, for instance, you could ask them, hey, Q, how physically active are you throughout the day? And if I ask you that question, you'd start going, well, I stand at my stand-up desk and I take the stairs and I park pretty far away from the door when I come in the morning. And you will have, as we all do, a bias toward telling me information that you think I want to hear, right? If I were to ask you instead, hey, Q, tell me about your day. If I say, hey, tell me about your day, and I haven't primed you with the fact that I really want to know about your activity, you're going to tell me a very different story. And it's that story that I really need to hear. So the way we talk about it in qualitative analysis is that you want to explore an investigation 1 or 2 levels of abstraction above your focus point. Because you want to avoid the biases, the sort of the typical attention that we give to those things. We are in an amazing, I started reading this book. I'm going to show you this book. Have you read this book? Peak Mind. Oh my gosh. She talks about this fact that we are all bludgeoned with things that catch our attention all the time. And so to answer your question, like how does a founder go about learning about the audience? We look for artifacts. We look in trash cans. We look at burnt out buildings. We look at community gardens. We look at traffic patterns. So there are artifacts of people we can learn a lot from. We can talk to people themselves in a very anthropological way. And then we all have, survey design and more sort of, surveys are they're a less nuanced way of doing things, but certainly they also lend to the picture. So I always advocate for sort of multimodal, learn by whatever you can learn from, and be cautious in that learning that you aren't biasing your sort of thematic understanding by the way you're asking the question. Does that hit the high spots there?
Yeah,
Customers
no,
lie.
absolutely.
Ed's like, customers lie. Ed is right. Customers lie. They lie, but they also aim to please. And yeah, don't need lead the witness. Exactly. Because we all want to give the right answer. You know, we're all very attuned to that. It's human nature. And so, that process in public health, we call it formative research, and it applies to the whole spectrum of what you do. What ideas you want to take to market, what those ideas look like, validation, ideation, examination, like studying the impact. What colors do people like? How do they like to scroll? Where do they like the positioning of their tools, right? So it's not just at the beginning where you say, hey, customer, what would you like? It's like all the way through this process. And you have to have a certain amount of humility and vulnerability to really even ask that question, because you want to be like, I don't really want to know what you think because I have my own idea about what a really great solution is. So I'm going to ask you, but just don't be too honest. And that's the kind of thinking that gets us in trouble. Other questions? Okay, I'm going to move into another piece of this pie, which is health communication. And health communication is a lot like marketing. Y'all probably just call it marketing or health marketing maybe. But this relates in a very nice handshakey way to the content of what we need to tell people to be persuasive. Health communication is like how we need to tell them. And no joke, this idea that our attention is so diverted. I was listening to a podcast the other day. He said, how many of you, and I would challenge you to answer this question. You can provide the answer in the chat, or you can just think it. How many of you can read a book for 1 hour and not check your phone? Okay, I was like, that's not me. I used to be able to read, like sit down on an afternoon, read my books about it. Now I like read my book, and literally I'm starting to have to train my brain again to attend to the things I need to attend to and rebuild my focus, right? And the same is true with the people you want to buy your products. That you get a sliver of time to interact with them, to engage with them. You send them an email, it's going to be deleted. You post on Facebook, it's going to be deleted. LinkedIn, deleted. You are in competition with a sea of noise. It's baffling to me. I mean, how many of you actually have completed a survey that somebody said, thank you for your J. Crew purchase over the holidays. Will you please rate your satisfaction with the cashmere beanie, which I did buy my son. He seems to like it. I'm not going to fill out that survey. There's too much stuff going on in my mind. And so we're constantly competing with this noise. So here's a framework to think about how to forage or strengthen, fortify your position in this information landscape that is so hectic. We think about communication in terms of the sender, the receiver, the message, and the medium by how that happens. And these are all important levers to move. So you might, as a founder, have a really cool idea, but you personally may not be the best vehicle for delivering the message about your product. So we did some work early on in the Cardinal Glennon Pediatric Clinic, and we asked parents, who do you like to get information from about parenting? And they were like, well, I mean, my pediatrician's okay. And I mean, I guess my friends are okay and magazines are okay, but really it's my grandmother. So if your audience tells you, okay, yeah, you have an MD, you have a PhD, and you seem to know lots of stuff, but really I want to hear from my grandmother, then you can use that information to make sure when you're communicating with these parents that they're hearing from their grandmothers or a grandmotherly type or someone with the authority of their grandmothers, or that you get the grandmothers to help you develop your daggone content. So this discovery process is not just, hey, parents, where's your pain point? But who do you listen to? Who do you value? Who's in your life that matters to you? And those people can become important parts of this message. And in doing so, this message strategy of like, okay, how do we talk to people about these innovations we have? We're intersecting credibility, like when you guys do your pitch, you have to establish yourself as an authority. You have to be perceived as credible. You have to have that message very clear. What's your ask? It has to be persuasive. It has to be consistent. Your communications have to be, you have to respond to emails. You have to post on LinkedIn, right? So these strategies together help us to increase the relevance of our message. And relevance is in red there for a reason. Things that are relevant become adopted. You pay attention to things that are relevant. You've all been in the grocery store line and you're looking at like a vegan Thanksgiving dinner. And I'm like, okay, well, that's not me because I'm not vegan. And I go over here like how to handle the temper tantrums of your 2-year-old. And I'm like, okay, let me grab that instead. So we all pay attention. We are scanning and seeking all the time. And if somebody doesn't tell me in what ways that message is relevant to me, I'm going to just move on. And so that relevance is part of building this informational environment where they're like, Q, if I have a question about, this one small part of my business, he's my guy. I understand, I believe, I know that he has demonstrated credibility and he's going to give me useful information. And that's important. That relationship is more important than just trust. It allows you to myelinate this pathway in your innovation process. And here's another important point. Okay, so there are 2 different kinds of people in the world. That's a gross generalization, and it's not about cats and dogs. There are some decisions we each make that we like buy into the decision-making process, right? So we could be at the grocery store. Grocery stores are such a great example. We could be at the grocery store and we could care very much about, I don't know, pick something, non-dairy items or cereal. So we might be in the cereal aisle and we might care a ton that we don't want sugar in our cereal. So we're going to pick up the boxes. We're going to read the ingredients. We're going to look at how many grams of sugar. We're going to be thoughtful about that decision. All right. There are some people who are going to be like, oh, look, it's a cute little animal on the front of the box. I want that. And they'll grab the cute little animal box, paying no attention to the sugar content. So we call these routes of processing the central route, where we're really deeply engaged in decision-making, and this peripheral route where we're like, oh, pretty colors. I mean, my daughter was home over the holidays and we went to a store and we were looking at these little bottles of juice. And she goes, well, I'm just going to buy it because I just love the bottle it's in and I can use it later to put flowers in, So she doesn't care it's beet juice. She cares that it's in this cute little bottle. Now, why is that important for us? Because 2 reasons. Well, probably lots of reasons. People who decide what to purchase based upon a really thoughtful approach to that purchasing decision are likely to be much more brand loyal, stick to their decision, and be highly motivated to come back and buy from you again. So it behooves you to understand, is it sugar on the back of the box they're looking at? Are they looking for dairy? Are they looking for, what are they looking for? I don't know. So this becomes part of your customer discovery. If you know that when I buy cereal, I'm going to look at that box, then as a cereal developer, which I assume none of you are, so this is a very bad example, you want to know what to put on the cereal box, right? So that's why we started doing like all those things, organic and no MSG, and because our customer discovery told us, people are really not going to be keen on that. No nitrates on bacon and whatever. So why are they putting no nitrates on the bacon package? Well, because they heard from their customers don't want any nitrates in their bacon. Now, there are also these other people that are like, well, the packaging looks like it might be organic, good enough for me. You know, they're running in, they're running out, and they're putting stuff in their cart. And we all do this. There's some things I'm very much a decision maker about. Other things I look for cute packaging, and other things that I'm not really attending to at all because I'm like on my phone while I'm grabbing this thing that I habitually buy. And these routes are useful because as we start and continue this customer discovery process, we want to make sure that how we're talking to our customers is in a way that they get, that resonates with them. We want how we speak to them to be accessible, comprehensible. We want really these stakeholders to be involved. And so what does that mean? It means that we can tailor our pitch to our audience or to a group of people. We can use what we know about people to customize our messaging about our products. We also can really guard against this idea of using very complicated language. And I'm an academic, and academics do this all the time, but we think that in order to establish our credibility, we have to use lots of jargon and fancy language and sound really smart. And that's, in fact, that works against us a lot of the time. What is more real and authentic and connecting humans often feels a little bit like you're really respecting the relationship you have with your clients. And then lastly, in this space, this is maybe the most important thing. I know we talk a lot about like, where's your pain point? And we want to have a solution that addresses that. We don't want to get too attached to our solution until we really understand what our solution is aiming to solve. But we do this all the time, this sort of disregard of values. And I think we are really learning during times of social unrest and COVID and political division and all of these things that are really kind of nipping at the fabric at some of our work. We have not, in my assessment, listened to each other's stories as much as we really needed to, and as much as we need to. We have not really shown people, folks, investors, consumers, customers, how our work in public health, how our work in the founder startup space can really help their lives be better and really connect them to what they value. I remember my mom, she begrudgingly had a gym membership. And so she got a gym membership and she's like, okay, I'm going to the gym. And she was very not happy about the fact that she had to go to the gym because, you know, muscle tone and whatever else. And her doctor's yelling at her. So she gets this gym membership and she's going and she's going and she's going. She's just like, rah. She's not happy about it. And she won't like go into the locker room or anything. She just does her little thing. She leaves. Okay. And then she became a grandmother because I had a kid. And all of a sudden she's like, well, she got a gym bag. She got a locker combination. She hired a trainer. She's like, well, I have to be a really good grandmother because that's what she valued. Her value was in this identity of being a grandmother. So if you can connect what it is you're developing, this business model that you have, with what people value, not what they like kind of value, like I want more money and I want a nice car, but really like their ultimate life values. And you can demonstrate like a consonance between those things. You know, you'll really see a huge expansion of what it is you're able to do. So these are just some ideas, sort of how we position ourselves, both theoretically with some kind of behavioral science theory stuff, and some pieces about communication science. Now, these things I've just sort of, I've hopefully just piqued your curiosity because there are tons of theories and tons of communication models and tons of message map exercises and such. But I hope that as you're thinking through these things, you can pay attention to what levers you have and how even subtly making some adjustments might help position you in a more advantageous space. So I'm going to tell you about this my sloppy trajectory into innovation, but I'm gonna stop sharing for a minute and ask if we have some thoughts about that. Oh, I turned off the phone. Okay, let's think about this here. Not me. Okay, good. Nobody can read a book. Okay, I feel like happier now. Oh, Ed, if he turns off his phone. Okay, that's good. If you force yourself, good. So you leave your phone in the other room. Can't without an hour. Someone's attention for 1 minute more. Yes, 6 seconds. Exactly. I often encourage people on a budget to be very mindful of the medium they are using. Yes, exactly. Those targeted ads, being mindful about where that piece is. 18 months and a kid knows a McDonald's logo. Ah, you are so right. I've started this sneaky thing. I'll tell you, this is terrible. And I hope my kid can't hear me. I've started this sneaky thing of posting on my Instagram story messages that I want my children to see, because my kids won't look at my text or talk to me or whatever, but I know they watch my stories. So I go make up a little digital thing. I post it on my story and then I see that they saw my stories. I'm like, hey, I got 6 seconds with this kid. At least they saw what I wanted them to. Hey, Valerie, why don't you go ahead and unmute and you can chime in here.
Hi,
Hi.
this is Sherry Sykes. I'm on here with Valerie because I didn't get my theme. My theme won't come on.
Oh,
so I could join the class, so that's what's going on.
Well, I'm glad you were able to join us.
Okay. I just wanted to chime in and let you know that I'm here too as well.
Yay.
Okay, thank you.
Sherry. Any other comments or questions about where we are in this little thread of science versus business? Okay, so here's the fun piece. I don't even need to share my screen yet. So I started developing, I'm an injury prevention scholar by training. My PhD was in injury control, and I do a lot of work on how do you keep kids safe from being injured. And as a young professional, I thought that what you did is you went away and you developed this tool. I have an injury prevention tool. And then you start walking around with your hammer, my tool, and you looked for all the nails. Like, okay, who wants this injury prevention thing that I developed? And the first thing I developed was called Baby Be Safe. And then there was another project called Rise Up. And then there was another project called Support Over Silence for Kids. Like there were, that's what you do in academia. You sort of build on your things like 2.0, 3.0. Okay, so I was a little, I don't know, naive, I think is what I was. And I took my Baby Be Safe and my Safety in Seconds and Support Over Silence and all these very cool programs I developed, if I do say so myself. And I took them over to the hospital, the pediatric hospital. Knock, knock, knock. Hi, pediatric hospital. I have this thing I developed and I know you will love it because you also, like me, care about kids not being injured. Okay, well, the way I set this up, you know the answer. How resounding of a welcome did I get from the pediatric clinic? They were like, nah, bye. I mean, I was bruised. What? I mean, I had this grant. I have national partners. I did this thing. Don't you want to keep kids safe? Well, this was my first lesson in entrepreneur. Yeah, yawning, right? Oh. So then they go, well, tell me, how long does it take for people to do this thing you have? Because I'll show you. I'll share my screen again. Here's what we developed. It was a series of these things. So we had this Baby Be Safe. We had home visitors that would go out and who would talk to people about the safety stuff in their home. We had this really cute little website. We integrated it with a bunch of parenting, tailored stuff for Tyler, parenting things. All this was theoretically based. The communication science was on point. And they still had these. They still had brochures up on their clinic wall. And I said, hey, you don't need that brochure. You need this cool thing I made for you. They're like, brochure. I'm like, no, cool thing. They're like, no, brochure. So I started asking. So then you got to ask questions, right? So notice this about customer discovery. The first line of customer discovery, which I knew we needed to do, was talk to the parents. Hey, parents, how do you keep your kids safe? I mean, I asked better questions than that, but you know what I mean. We talked to parents, but I didn't think about talking to the adopters of these programs I was building. I mean, I did, but not in a real way. It was the tell me what you think, but not really way. So I built this whole thing. All right, well, then I said, well, how long does it take for people to do this in the waiting room? I said, 12 and a half minutes on average, plus or minus 97 seconds. No. What? Well, we can't have your program interfering with our clinical protocol, with our patient satisfaction surveys, with our wait times. We can't have people in the seats in that way. And they had a bunch of legitimate organizational concerns about why my hammer was not going to be able to crunch their nail. And so it was my first real awakening that a couple of things. One, customer discovery is not just, hey, parents, it's, hey, legislator, hey, funder, hey, CEO. It is learning from everybody who even comes in contact with this thing that you're building. So then I got smart and I got a grant in R21 and we studied this question like, okay, hey, I've got really cool evidence-based, theoretically informed innovations on my shelf. I'm going to give it to you. So we partnered with all the children's hospitals in the whole country and we gave them technical support. And we said, here is this beautiful hammer. And we studied like, okay, who took advantage of the hammer and who didn't? Well, here's what we found. We did this really cute little analysis. Here's what we found. If the hospital had a medical director, that was the single most important factor in whether or not they adopted support over silence. The single thing. And the next was, are there other people in their hospital doing things? The next is, are they engaged with requests for this kind of support? And you don't need to know all these details, obviously, but the thing is, that surprised us. So be prepared when you are out pitching your product that the people and the situations that you think might be really relevant to people buying your product may be totally different than you think. What it turned out is if a hospital had a medical director, that also meant there was a lot of bureaucratic red tape to get through, and they were less likely to want to be able to adopt my program. For the hospitals that did not have a medical director, they could do whatever they wanted. So they were like, bring it on, bring me your cool thing. So it told us two things: that we've got to really focus on those medical directors if we want to pitch our product to the hospital. And also we shouldn't be foolish enough to assume that we knew who we needed to pitch to. So it was a very telling time in my career because I went from this, which was like super cool, to models that worked much, much better. And so now what I'm doing, just to kind of conclude with sort of where the sloppy story ends, I'm doing a much better job on customer discovery, on really thinking about the integration of users in important ways. And as we say in public health, I'm designing better for dissemination. So I'm not just designing things because they're cool, although they are, and I like them, but I design right alongside the people and the places and the organizations and the communities that will likely be consumers of the product that I'm designing, like way lockstep with those folks, like locked arms, three-legged man, tie your leg together, lockstepping with those folks. And that's super helped because not only am I able to garner support for what I'm doing now, those people come back to me and they say, hey, you're doing supportive or silence for kids. I have a group in Massachusetts that wants to adopt something like this. Can I partner with you to do that? Well, the answer is yes. Because then you start creating these vibrant communities around what it is you're doing. And if you can coax yourself to be very generous and gracious and vulnerable in those situations, it just amplifies the impact that you're willing to make. So that's my sloppy story. My pro tip, when these folks are telling you, you got to ask the 5 whys, you kind of got to ask the 5 whys. So I'm going to stop there. I would ask if you want to connect with me. LinkedIn's probably the best way to do that. Or you can email me at nancy@weaverly.org. And I'm going to stop sharing so we can kind of continue to have a little Q&A here.
Yeah. Thank you, Nancy, for sure. Anybody have any questions, feel free to unmute, come in and ask them or throw them in the chat. We'll keep an eye on that going forward here. I think that for me, I have one more to kick off while we hopefully let some other people stew on what theirs might be. It's how do we, so you did this study, which I think is awesome, of determining what the factors were that got hospitals to adopt this thing. How would you say, or is there a way that you would say that a startup founder that is not based in doing research studies and analysis could do something similar, right, with their product, with their market, to try to find those unexpected gatekeepers or buyers or decision makers?
So that's a good question. Part of the answer is that the research world does that research. I mean, there's a whole field called dissemination and implementation now. And so the scientists among us are really thinking about those kinds of frameworks. One's called the RE-AIM framework. So founders just take advantage of that science base that's evolving. Go to reaim.com, look at translation and dissemination pieces, work with your librarians to find some of this information. So we're building and scaffolding, some of that information about what that is. And so that's one piece. The second piece is, we call it it's called snowball sampling, right? So if you ask questions in a really keen way, you could go to the head of the emergency department and you could say, hey, what do you think about using this thing? And they might tell you you love it. And then you would say, who else do I need to talk to? And so if you continue to snowball, who else would be involved in this decision making? Who has the authority to approve this expenditure? You can learn a lot, again, by just sort of tripping down those lines of inquiry, if we will.
Yeah, no, I think that's a great answer. I think that we talk about the 5 whys of what your customer wants, but the who else is probably one that would be added to that, right? As a super valuable question to be asking when you're going out and having these conversations, even if it's with your customers, right? Who else can I talk to? Who's your friends? Who you trust with this kind of thing, right? Who do you turn to? I know for myself in decisioning, I was really thinking through how I decide to buy things has changed over the years, right? There was a time when I would have spent hours researching a thing that I wanted to buy to try to find the best one. And now, because I don't have the time or don't want to spend that time doing that anymore, I wind up trusting review sites, right? I have trusted review sites and I just go and see what they recommend and I'll just buy it I'm yep, I trust what they say. I'm not even going to look, right? And just go with that. And so I say that to say, I think that these principles we're talking about also shift over time for individuals as well, right? How they decide.
Well, I started listening to, I heard an ad for a podcast about podcasts, and I was like, oh, that's a good idea. Let me listen to a podcast because they're going to tell me which podcast to listen to. And I thought, what have we come to? It's your review sites, and you wouldn't learn that necessarily if you weren't willing to ask that question. So yeah, it changes over time. It changes in context. So yeah, I appreciate that.
I think too, one of the things I appreciate you bringing up sort of that the chart that you had that was sort of figuring out which one of the profiles, like, of potential customers was showing the most traction. I think for the most part, it's literally just taking some time to document your conversations and document what that profile is. So, I think we see a lot of times, founders, even if they're finally getting out there, they're getting the courage to have those conversations, taking the opportunity to sit and go, okay, that was a hospital that had this many beds, was structured in this way, had this, and you have that, because it not relying, like, it seems like you always think you're gonna remember. Oh, I talked to so-and-so and we said this and we did that and that was that situation. And we never do. And so when you go back to try to look for trends, you don't even have if you don't do the data collection as you're going along. And I mean, we knew in asking you to speak tonight, like I didn't know how on point what you were going to say is for exactly where we are in what we're trying to encourage our founders to do, especially with the Lean Stack platform. But it's using the tools that are in front of you. Like, I think it's just getting in there and putting down the data as you're doing it in real time and capturing that moment. So when you're looking back and trying to look for trends, don't just throw up your hands and be like, I can't do science, that's not me, I'm a scrappy, whatever it is, and take the time to use the tools to document the stuff. So I appreciate you for reinforcing that, the benefits of doing that.
I just think a lot of founders, like you were saying, Nancy, they're so bombarded with so much stuff out there. Melissa, to your point, it'd be great if they sat there and did everything, but they get distracted and then they, go a different direction, or they're over here or over there. That to me is, I think, a really big, issue with a lot of people. It's just hard to concentrate on one thing at a time because their minds are going in different.
Well, and sorry, I interrupted you. To go back to the theory piece, though, founders don't perceive that maybe documenting that information is going to be useful. So maybe we need to have some experience where we say, see, we documented, useful. We didn't document, not so useful. So we have to demonstrate the utility of the methods that we're teaching so that we can be persuasive that method is important, because you don't want to box yourself out. Like, I remember the first time Q was like, you got to go do customer discovery. And I was like, I hate you. And he said, no, you're really going to go do customer discovery. Well, I already know what that is. So I have a program called Support Over Silence for Kids. And it's a bystander training model for when you see parents and their kids struggling in public. And I've always had this thought, I want to take it to grocery stores. He said, well, you got to go talk to grocery stores. I was like, no, I don't want to know. So finally I was like, okay, I got to take it to grocery store. So I go to the grocery store. Like, sight unseen, walk in the grocery store. Hey, can I talk to the manager? And manager comes out and I said, do you see, I probably asked this question the wrong way. Tell me about a time where you may have seen a caregiver and a child kind of struggling when they were in the grocery store. And this manager says, we don't really see that. And I was like, then what am I going to do with my solution?
Well, the manager's never on the floor. It's the clerks that.
Which grocery store do you shop at, Nancy?
Right, exactly. And anyway, okay, I got to go to a different grocery store. But
this is who else might have seen that? Who else did I talk to?
Who else? Where else? What do you see, right? I totally believe that, because you could get discouraged, but if you weren't documenting that, you might not see, like, geographically. If you go to West County and you're at Trader Joe's out in Des Peres, maybe they don't see it. So if you're documenting where you saw it, who you talked to, you might see the pattern. Like, in this community, they see it a lot. In this community, they don't see it a lot. At this type of store, yes. At that type of store, no. Trader Joe's has cute little kid carts and little things, and they give out where's the monkey and here's a sucker. Like they cater to that, right? So you would be surprised to see it in Trader Joe's. So if you did all your discovery in Trader Joe's, you'd be like, well, I'm out of company. So it's important that you develop a bit of a thick skin and figure out how to navigate some of those processes for sure.
Yeah. And I think that's an example too of what it might take is what our founders typically is conversations with users, knowing that they aren't going to be the customer, not the one making the decision and writing the check, but you've got to go to that customer and say, I've talked to parents, cashiers, the guy in restocking produce who gets bananas stolen and thrown in his head at a regular basis. I mean, the manager is very rarely on the floor at a grocery store a lot of times. So he or she probably isn't seeing it. But you can go to them when they need to make the decision and say, I have had all these conversations. I've documented it in your store with the people that have to deal with it, the front end user, parents, whatever. And then you need to offer this as a unique value proposition to your grocery store.
You're exactly right. I did that. And we did 19 focus groups. We thematically analyzed them. We transcribed, we came up with themes. And I won't tell you the store, but there was one particular place that came up a lot when we said, where do you see this? And everybody told us where they saw it. It's pretty clear. And so there we go. Like, I'll be right back. Let me run over. And it's the value proposition. You say, like, we have evidence we'd like to share with you, or data that's useful, that tells a story that there may be an opportunity for you here that we can help solve. So not only are we like ideating a solution, we're clarifying for the end user what their pain point actually is that they might not know that they even had.
Mm-hmm.
For sure. Yeah, that's awesome. I love it. I'm glad also that my asking you if you talk to any grocery store owners every week for like 5 weeks wore you down. It wore you down, and you finally went and asked them. And I appreciate that works as a method. So, any other final questions or comments for Nancy? Seeing none. Nancy, thank you so much for coming and sharing this. I think it's super valuable, and I think that it was definitely an interesting talk. Of looking at it from a different perspective, hearing about it from a different mindset, industry, and kind of angle, but still extremely relevant to everything that our founders and innovators are facing. So appreciate you coming to do that. Appreciate everyone for showing up that did virtually. As I said earlier, hopefully next month on the third Tuesday, we'll be back in a hybrid formation for our innovation matrix. Also wanted to point out for those of you who are interested in participating in validation, that we've extended the deadline for that till the 28th. So not this Friday, but next Friday. So if you know somebody who'd be a fit for the validation programming, have them apply, and we'll get them into that program. So otherwise, I hope everybody has a great evening, and appreciate you guys taking the time to come by.
Watch this. We'll have this up on YouTube. I should say Connie will have this up on YouTube. Who am I kidding? In the next 48 hours or so, probably, depending on how well the video cooperates. And then you can just push it out to all your friends and relations that needed to be here and needed to hear it, and were afraid to be told what they needed to hear. Like we all
tell them they need to go to the grocery store. That's what they need to hear.
Wear them down. Thanks, guys. Thanks for having me.
Yes.
Thanks.
Absolutely.
Thanks so much, everybody. Have a great evening.
Bye.
Good night.
Night.